Hello and welcome to Positive Parenting. I'm Deanne Conrad, Community Relations Supervisor for the Sioux Falls School District. Positive Parenting is a joint venture between the education professionals of the Sioux Falls School District and the medical and child development professionals of Sanford Health. Our topic this time is stress and students. Whether we realize it or not, stress can impact students from 5 years old up to 15 and beyond. And there are a lot of things going on in the lives of students these days that require their attention, their focus, and sometimes that does lead to anxiety and stress situations. So we're going to discuss those issues, offer some advice about how to help your student if they're dealing with that type of stress in their life. So we have some wonderful guests to join us today and help us with that conversation. We'll have them introduce themselves now.
I'm Molly Satter. I'm the Health Services Supervisor for the Sioux Falls School District.
I'm Celeste Youthy-Bureau, the Student Support Services Coordinator with the Sioux Falls School District.
And I'm Tracy Jones. I'm one of the general pediatricians at Sanford Health.
So thanks to you all for joining us here today. Usually when we think of stress, we think of our own stress. Oh my gosh, nobody has as much stress in their life as I do. It tends to get self-involved, that my stress is through the roof. And it is true that children stress about a lot of different things as well. Do you work with families or hear that children of all ages are stressed?
Absolutely. I think children, even in the, toddler years all the way up to adolescence, there's obviously different stressors that they're experiencing, but by all means, children of all ages can experience stress and be stressed for different reasons, and trying to identify what those factors may be are going to be really important for the health and well-being of the child.
Right. So at the toddler age, I'm guessing some of that has to do with just frustration of no one
figuring
understands
it out.
me, or I can't open this cupboard door because it has a lock on it that they don't want me to, So obviously the stressors are, as you said, different at a younger age, but a lot of times it's frustration, and that in the younger children, but too, I suppose, frustration at the high school level
age too.
as well. Mom and Dad don't understand me.
Right.
No one understands me. So what are kinds of the conversations that you're working on with families when you realize we're not on the same page with each other and things are getting frustrating or stressful?
I think it varies from family to family. Sometimes the parents really identify that there's something that seems to be stressful for the child, whether that's academics or social environments, something going on at school, whether that's a poor interaction with a teacher or a friend. But there's also family stressors that play a role in that too. So their increasing rate of divorced parents and having separate households, and that can play a huge impact on the child. And so oftentimes families can identify that that's going to maybe be an issue and trying to work through that. Sometimes the parents may not recognize what's going on, and being able to have that conversation in a neutral environment in the doctor's office with the child, whether the parent is present or not, can really shine light on some of those situations, and then allow the child and the parent to have that deeper conversation to really figure out what those stressors may be and how they both can help each other get through that difficult time and kind of figure out how best to manage it.
A lot of that can manifest itself in a school day, just because that's where students spend a lot of their time. So whether it's a situation that is stressing them out regarding academics or home life, usually because it's during the day and that's accessible. A lot of your folks that you supervise tend to be in the line of helping students work through those stressful situations.
Absolutely.
Counselors and school nurses.
Absolutely.
What are our counselors doing, or how do they recognize these situations of stress? And are there methods that they're using
Sure.
going into the classroom or that
Absolutely.
type of thing?
A lot of times it's first noted in a classroom. Usually a teacher will notice that his child might be more stressed, and it'll come through in behaviors. Maybe they might be a little bit more short-tempered about something, or they might verbalize it, and so then a referral is made to the counselor, and the counselor will work with them and just try to find what the root of that stress is. And a lot of times what they uncover is that a lot of times it's the cognitions or the messages that they keep saying in their mind, and it's what they connect to something like, if I don't pass this test, I'll never make it through college. I mean, those kinds of if, ands, or buts, and those, really difficult situations where that's not accurate. And so a lot of times what the counselors will do is really go to those cognitions and identify the faulty ones and help them to put that in perspective, and then really eliminate those and put new thoughts in their mind that are more proactive, more productive. It's like, I really want to do well on this test, so what I'm going to do is do the best that I can, get a good night's sleep, study a little bit every day if I can, and then try to do my best at the next test, and try to give them those coping skills so that they can learn how to transfer that with other stresses that might come up throughout their day. So that's a lot of the big things that they do in working with kids in stress.
Right. Do you think that there are more stressed students today than 20 years ago, or are we just identifying it at being more open and aware?
Absolutely. I think there are more stresses that are out there, and I think a lot of that comes not just from academics and peers and those things. I think, in our technological age, we get to see the world and different people's lives very, very clearly, and so they might not measure up to our lives or what we think our life should be. So for instance, somebody lives in a huge house and they have money to do anything they want and take trips and stuff. My life is not like that, so therefore maybe there's something wrong with me, and so that becomes a stress. Exactly. I mean, even things outside of school that kids will stress about that normally we wouldn't think of them as stressing. Sometimes we'll find that, and that kind of opens our eyes as counselors to say, yeah, these kids are really feeling some stresses that we never had to deal with too, that we have to learn how to help them cope with.
Right.
Yeah.
And I think one of the things we often think of with high school students is, ACTs are coming up, or there's a large, I submitted my essay for a scholarship and I have to have the scholarship, otherwise I'm not going to be able to pay for college. I'm not going to be able to do what I need to do in order to be successful in life down the road. And certainly there are, I mean, those things are prevalent. We had ACTs 20 years ago too, but I don't know, I don't think we talked about college debt. And maybe we should have been talking about college debt 20 years ago. But I think that's more real to kids these days. There's more information available to them, and that can lead to the stress.
Absolutely, absolutely. And there's no one way to do things, and I think sometimes people get locked into thinking there's one way, like paying for college. I mean, that's a great thing too. That's a big stressor. A lot of times, not only for kids, but for the families themselves. So then you get kind of a group stress going on. And so that's the things that we can take a look at. I've always been told too that college debt is a good kind of debt. So getting that message out there too. Even if it's debt, do we have to look at it as bad and stressful? Maybe not so. And just kind of challenging some of those cognitions that are getting us in trouble and stressing us out more than they need to. Because there are some kinds of stresses that you don't need to stress about that. You know what I mean? And just giving the kids the information that that's not something you have to stress about. Because kids really do look to us to figure out whether they should remain stressed or be stressed about something. So we have quite a bit of power in being able to assist kids with that and letting some things go.
Right. I'm guessing stress presents itself, I guess first thing I think of is a headache. Headaches coming to school, nurses, things like that.
Absolutely.
Is it more prevalent in one grade level or school
I really don't
level?
think so. I think you can see it elementary, middle, or high school, and you see it manifest itself in a variety of different ways: headaches, stomach aches. Sometimes it's a full-on panic attack where they're short of breath and things like that. And so it's really just, our nurses are very good at talking through those situations with children and trying to determine what the cause is. And kids don't have the ability or the knowledge a lot of times to say, I'm feeling stressed right now. So they just come to you with some other concern, and then it's really trying to get to the root of that and figure out what the problem is. And a lot of times it can be just very helpful reassuring them right now that you just seem anxious, and let's take some deep breaths and let's calm down, and just kind of working through that and giving them the tools to physically be able to turn off that fight or flight that sometimes gets activated. And so calming them down in that way. And then again, we talk to parents and try to figure out, if there's major stressor going on at home, and giving parents also the tools to work through that, and if needed, referring them on to their physician so that they can have further conversations. And again, the nurses work closely with counselors and making sure they refer on to them as well. So
I think there's always been a, a sense of comparing yourselves, especially among kids, comparing yourself to this friend or that friend or whatever, and that feeling of not living up. But my mind goes back to the Leave It to Beaver, from early, and you think, gosh, that was a beautiful world, My life is nothing like that today, but most aren't anyway. And I think some of it is just becoming real with what, when you're in high school and you're taking an ACT, of course you want to do your best, and of course that might make you nervous and stressed, but everyone else who's ever been through the ACT has been nervous and stressed too. So we need to keep that in perspective.
Absolutely, and again, to kind of go back to the points that were made previously, I think social media is just a new thing that we're all trying to kind of figure out how best to counsel children on. Everybody puts their best self out there on social media, and so that's really hard for children, I think, sometimes to realize that everybody looks like they have these perfect lives and they're getting to do whatever they want because they have money at their disposal. But there's things like the ACT that affects all children, and to really be able to counsel them and allow them to understand that those things that are put on social media don't always reflect exactly what's going on in everyone's lives. But it's tough. It's tough for adults to understand that as well. And so that's, I think, just a new thing that we're all trying to kind of work out and figure out how best to handle that.
And 20 years from now,
there'll be something else.
Yeah, exactly. There'll be something else. I think as a parent myself, where I find myself is sometimes, do I jump in and try to help in this situation, or do I allow my kids to work it out and to, figure it out on their own, not because I'm not paying attention to them, but because I'm trying to help them build a little bit of independence and a sense of ownership or responsibility for their feelings. And I don't know, is there is there a perfect ingredient for that kind of situation?
I don't think that there is. I wish that there was, and then it'd be way easier for us all to talk to families about. But even just with participation in sports, the big thing that's been out there on the news is, do all children need a medal or some sort of trophy because they've participated? And it kind of plays into that thought as well as, do we let them kind of fail just a little bit? And I don't think that there's any wrong in that, allowing them some autonomy and ownership to those things, but to also know that you're aware of the situation as a parent, and to be able to step in and manage that is also, something that needs to happen. But again, as far as what that balance is or what the exact ingredient is, I'm not sure anybody knows. And parents of adolescents, I'm sure, can attest to that as well.
Right. Yeah, I think, as a parent, you feel sad when your child doesn't perform at the level that they want to perform. You're still proud. You're proud of what they're doing. But even conveying that to the child, I know my son's in wrestling, and if he gets something less than first place, his world has crashed right before him. And just those simple things, even as simple as, I am proud of you for going out there and doing your very best. And it doesn't matter to me if you're going home with the first place trophy or, nothing at all. But that importance of positive reinforcement.
Absolutely.
And I think teachers and counselors are probably doing a lot of that during a school day as well.
Absolutely. There's a lot of putting things in perspective, I think, for kids that's so necessary. Because look at the strength that you just talked about with your own child. With that, is he had a high goal for himself and shot for a mark. That takes courage, that takes perseverance, that takes all those things. And kids hearing just that part of it, they'll start to really enjoy the fact that I'm able to do this. And they get less involved in having that number one spot and more about, you know what, I'm really working towards this, and that means I'm courageous and I'm doing these things. And those are the kinds of messages that they need to hear, because that's all a part of being and getting to a goal that you want to have. It's the process and getting there that's more important than actually getting there overall in life when you look at most things. So I think those are the things that we try to do, is give those positive reinforcements and help kids learn how to do that and be resilient on their own when those times come when we're not there to tell them those things.
Right.
So
I think one of the things I've become more aware of myself is that when you do make a mistake, it's all about how you recover. And that's, or
Absolutely.
if not necessarily a mistake, but when you've given it your best shot and it didn't work out the way you wanted, how do you recover from that?
Yeah.
And you can either be, you know, stomp off and have a fit
Yeah.
and make a spectacle of yourself, or you can, you know, embrace this was less than my best, and next time I'm going to do that. But that's a hard skill. Trust me, in the wrestling, in the gym, sometimes the adults are having the biggest difficulty with that kind of thing. But again, it's that modeling the behavior that's that we're asking of our kids.
You know, it's funny because one of the things too, I think that kind of is tied to that is that we're seeing so much more about that competitive piece, I think, and being number one. And we want kids to have that. But then there's also the whole group, what's the best for the greatest number as well, and everyone else. And so I think sometimes what we need to do as parents and as educators is help balance that you are very important and very special. And everyone else is very important and very special as well. You know what I mean? So it's okay to not be number one all the time. Somebody else gets to be, and that's a good thing too, and celebrating those successes. So
Yeah, that's a hard one to learn, because
is.
you know they get so entrenched in what they're doing, and you know, oh my gosh, I only got a 30 on my ACT. What? Exactly. You know, and so setting those high expectations is important, but keeping a good balance and putting it all into perspective. How do we recognize when students are getting to the point of too much stress? I mean, we'll probably turn the corner on something a lot deeper in conversation, but stress can lead to horrible choices by teens who are just feeling like there's nothing else I can turn to, and I turn to drugs or alcohol or, you know, even worse, suicide. You know, what's too much stress? Or it's different for every person.
Again, I think it's one of those things that sometimes it manifests itself in different ways. And so whether that's behaviors or issues with sleep at night or academic performance, you know, I think parents know their children best. They're with them the majority of the time, but at the same time they're at school for a large portion of the day. And so being able to identify that things just don't seem to be the same as they were, and trying to identify, is this child in trouble? Are they experiencing just too much stress, whether that's at school or at home? You know, but again, I think it's hard to know exactly how much too much stress is, because some children may be able to manage it a little bit differently than others, and how do you identify those that are struggling? And I think, again, that's just a relationship that teachers have with students that can help identify that, then allow the counselor to become involved to also let the parents know, but for the parent to also recognize that, oh, the grades are slipping, or maybe they're not hanging out with their friends as much as they used to, or their social circle seems to be changing, and really trying to be cognizant of something that has changed and maybe identifying that there is just too much stress going on.
Those conversations can get pretty heavy at that level when you're trying to help a student, you know, identify and figure out how they can calm their anxiety of this or that. But it's one of those available things where if you know, they turn to alcohol or drugs, and you know, that becomes, oh, I need to have this, otherwise I can't be calm, or I can't, you know, do the things I need to do. But again, counselors, nurses are there for support and assistance.
Absolutely. I think the number one thing important too is for somebody to be connected with them, especially parents, and also a teacher or a nurse or any staff member at a school, and especially being persistent. So if a child is changing their behavior and that's noticed, that should be brought to the attention of the child. And even if the child's resistant to not wanting to talk about things, to constantly come back to them and say, how are you doing today? You're looking like you're a little happier today. or whatever else, and just not letting it go, because you're showing that you care for them, but also let me help you out in whatever way we can. And then they'll open up and you'll find what ways that you can. And reaching out to parents, counselors then can reach out to parents to say, hey, at school this is what we're noticing. Because a parent can't be in a school. It's our job to let them know what their child's like in school. I have kids myself, and the number one thing I always want to hear at conference time is, how are they in a classroom? I'm not there to know. I know how they are at home. I know how they are with me and their friends outside of school, but how are they in school? And that's what we're there for, is to try to help out with that.
Right, and
Yeah.
identifying those things, those
Yeah.
changes, where usually
Right.
when something of a critical nature happens, there have been warning signs.
Right.
And you don't, as a parent though, you don't always know what resources are available to, help me with this. And it doesn't just need to be me as a parent dealing with it, but there are supports like counselors at schools and the nurses as well that can tie you to resources in the community and counseling services.
And certainly we see some of those serious situations where there's pretty immediate concerns, and then we're referring families out. We're connecting with parents and making sure that they get connected with their physician or other community resources, sources of help. We take that very seriously, and our staff are very tuned into things that students might say, and not just brushing it aside as nothing, but really looking into it, investigating what's going on, and making sure that student has the help and the resources that they need in a critical time. So,
and that is where partnership is so critical, where we're connected with community agencies and can make referrals for counseling services and things like that. And we are a partner
Yes.
with the police department and a variety of other organizations that can support and do
Absolutely.
when somebody presents.
Absolutely.
You want to just talk a little bit about that?
Absolutely. Our partnerships are great within Sioux Falls with our 2 hospitals that we have, as well as with Southeastern Behavioral Services, Lutheran Social Services, as well as Avera. And so like if a child is so desperate that they're actually talking about doing some self-harm, that's something that immediately a parent is contacted or a guardian, and a referral is made for an assessment. It's a free assessment for them to go through for suicidal ideation or any other kind of behaviors there are. And that's something that's just rote. We do it right away when there's something that might come up in a school setting that's indicating something like that. The other piece we have is that Southeastern Behavioral, through some grant funding, also can provide services for students to have a homeschool-based counselor. So that homeschool-based counselor, how that's different than a school counselor, is that they really delve into that family unit that we can't do as school counselors, because our job is to do the academics and the school pieces that interfere with being successful. They can actually bridge that homeschool piece, which is a really nice component to have, because then we can have consistency both in the home and at school on what's the best interest for this student, and find some great success with that.
Right.
Yeah.
I think, going to a counselor or going to a therapist or something like that has always held kind of a stigma, like, oh gosh, it must be really bad. But I think we probably need to do a better job of just sweeping that notion aside. Why do they exist if they're, they're to be there and help us think through things?
I think a lot of mental health issues, get that negative stigma attached to them, and our job as providers in the clinic is really to identify those students or children that may benefit from extra help and counseling, and to really inform the parents that this isn't a bad thing, that this is okay, and that this is helpful, but to let the student know as well that these people are here to help them, and that there's lots of other children just like them going through the exact same thing. And I think if they can realize that they're not alone and they're not on an island by themselves, but there are other people out there that are experiencing the exact same thing, I think a lot of those barriers are broken down, and there's a much better reception from both the student as well as the parent to seek out some of those additional opportunities that are available to them.
The mental health component has been talked about increasingly in the school system, where we have behaviors that are occurring probably because of these stressors that are happening, and so we're equally invested in trying to resolve these situations so that students can be successful, because it is a barrier.
It certainly is, absolutely. And different students come to us differently, equipped differently on handling stressors. Some are able to handle a little better than others. Some we're there teaching them, and that's a part of what we're there for, is teaching them how to cope, how to use those skills to de-escalate that stress that might cause them to be crabby or to blow up and want to throw things, and that's not appropriate to do. That's not going to help you. It's not going to help anybody else either, and here's another way to deal with it. And also not then to shame the person, just help them find a different way of coping with those kinds of behaviors when they come up, or emotions.
Right.
Yeah.
That can be integral to the success of not only the student, but the other classmates around them, just in general, helping elevate everyone and helping people understand, oh, well, yeah, this person was, very much in a stressful situation, but gosh, they handled it really well, or, this is the way I'm not going to handle it, as well. So all important factors. Any final thoughts you want to give about stress, anxiety, kind of the pressures of today?
One thing we didn't mention when we were kind of talking about students, I think oftentimes they change their behaviors, or they do things, or they say things because it's really an outcry for help. And so, having the teachers available, the counselors, the school nurses, as well as providers and parents to identify when those things may be done or said is really to hopefully have that conversation with the student at that time to kind of figure out what some of those stressors may be and to see how we can help them.
Absolutely. There are great resources in our community where people can go to get help. Those agencies want to help and are trained to do so, and sometimes we just need to ask a question about where do I go to get help for something like this, and here's something our family is working through. What's the best case scenario? What's the advice that we can take to make that situation better? So, we talk about stress kind of in a, oh gosh, we all have it, but it can lead to serious issues and cause major concerns for families. And so we encourage people who are feeling stressful to reach out to someone in their community, whether that community is the school community, the medical community, friends, family. Reach out. We're all dealing with stress in a different sort of way, and we all need help from time to time. So with that, we'll leave you, and thank you for joining us today on Positive Parenting.